Good evening, my people. We are still pushing on tirelessly on our daily educational bangers. Sorry. As per our promise since we started this channel. May I start by thanking you people for the support you are showing me so far. I always appreciate before making any video because it's out of your support that I'm where I am today. So let's continue subscribing, liking, sharing and commenting on our videos so that they may reach the whole community at large. Let's get back to our discussion whereby we have been tackling hemorrhoids. And I think each and everyone who has been following me, you know what is a hemorrhoid is and several other things concerning hemorrhoids. Today we will be talking about surgical procedures required for hemorrhoids. Surgical procedures required for hemorrhoids. So, only a small percentage of people having hemorrhoids will require surgery. Only a small percentage of people suffering from hemorrhoids will require surgery. However, if other procedures, if other remedies, including the home remedies, have been unsuccessful or doesn't give any good results, you have, or if you have larger hemorrhoids, your doc might suggest that you go for surgery or removal of the hemorrhoid. So, the recommended surgeries or the types of surgeries the doctor might recommend include the following. Number one, hemorrhoid removal or what we call hemorrhoidectomy. Hemorrhoid removal or hemorrhoidectomy. So, choosing one of various techniques, your surgeon removes the excessive tissue. Choosing one of the various techniques, the surgeon will remove the excessive tissue that causes bleeding. Hemorrhoidectomy is the most effective. This means it gives the best results. So, hemorrhoidectomy is the most effective and complete way to treat severe or recurring or larger hemorrhoids. Note this, complications of hemorrhoidectomy, because anything that has advantages must have its own disadvantages. So, hemorrhoidectomy has some disadvantages or complications that include: one, temporary, that means it's not permanent, temporary difficulty in emptying bladder or urination, which can result in urinary tract infections, mainly after spinal anesthesia. Remember, when doing hemorrhoidectomy, you can use, the surgeon might decide to use spinal anesthesia, which makes you lose senses halfway, or use what we call general anesthesia, whereby you lose complete sense in the entire body. So it will depend on the surgeon The choice of the anesthesia used will depend on the surgeon, and if you have, as a patient, you have some complications. So let's get to the next method, and doctor can recommend to remove the hemorrhoid. We have what we call, number B, we have hemorrhoid stapling. Hemorrhoid stapling. This procedure called stapled hemorrhoidophy. Stapled hemorrhoidopexy. It's a bit hard, but we will bear with each other. It's called stapled hemorrhoidopexy. Stapled hemorrhoidopexy. That way. Blocks or aims at blocking blood flow to the hemorrhoid tissue, especially for internal hemorrhoids. Stapling involves less pain than hemorrhoidectomy. That means hemorrhoidectomy has a lot of pain compared to stapled hemorrhoidopexy. So it involves less pain. So it has been associated with greater risk of recurrence and rectal prolapse, though it involves a small pain or a bit of small pain. It has been associated with greater risk of recurrence of infections or rectal prolapse. So, as we were saying, hemorrhoid stapling has less pain, but it has been noticed that it is associated with greater risk of recurrence and rectal prolapse, whereby part of the rectum protrudes from the anus to outside. Complications in stapling include bleeding, urinary tract retention, and pain, as well as life-threatening infection or sepsis. So, this is a question we have to ask ourselves. What should a client or a patient, know and ask his or her doctor? So the questions you as a patient, when you visit a healthcare provider, what questions should you ask him? The common question you should ask him or her. Number one, what is the cause of hemorrhoids? Obviously, you will have that question in your mind. What is the cause of hemorrhoids? Number two, what is the cause of the symptoms you are having as a result of the hemorrhoid? Number three, is the condition or is hemorrhoid temporary or permanent? Number three, you as the patient, are you at risk of complication of hemorrhoids? Number 4, what is the best treatment approach for hemorrhoid? Number 5, is surgery needed or not? Number 6, self-care steps to take that may help. Are there any self-care steps to take that may be helpful to relieve the symptoms or to eradicate the hemorrhoid at large? Number 7, if I have another medical problem, or if you have another medical problem, how can you manage it with hemorrhoid? Those are the questions, the common questions a patient or a client will have to the doctor. The doctor, for him or her to be able to assist the client, the doctor will also have his or her own questions. Number 1, how uncomfortable are the symptoms, so that he or she may know if they need an immediate action or they can be planned, or whether the treatment should be immediate or it should take time. Number 2, what are your typical bowel habits, or how do you pass your bowels? Number 3, how much fiber does your diet contain? How much fiber does your diet contain? Number 4, what, and if anything, what seems to improve the symptoms? What, and if anything, what seems to improve your symptoms? Number 5, what, and if anything, that worsens your symptoms? Number 6, is there any history of hemorrhoids in your family? Is there any history of hemorrhoids in your family? Number 7, and how are the changes in your bowel habits? And if both the patient and the doctor agree on the questions I've just mentioned, they will arrive at an answer and the best solution to the hemorrhoids. This marks the end of our discussion about hemorrhoids. I hope it has been helpful for you. So, let's continue subscribing, liking, and sharing our videos. And in our next video, we'll be talking about another condition, which is puerperal sepsis. So, let's meet in the next video.